If you have pain in your chest, or more specifically, pain that is radiating into your arm or your neck, or even more specifically, associated with fainting and shortness of breath, then you might have the condition called the aortic stenosis. Well, what is this aortic stenosis? Well, first of all, it's not aortic stenosis, it's the stenosis of the aortic valve. And this valve is the valve between your left ventricle of your heart and aorta, the biggest artery in your body. Heart is pumping blood to aorta, and it does so through the aortic valve. This valve should then close and not let the blood come back into your heart, because this blood should go to your other organs. This valve also should not be too narrow, because blood from the heart has to pass through it. And what happens when we have narrowing? Well, we have a condition called the aortic stenosis. This normally is caused by the degeneration of the valve through calcification or rheumatic processes, as well as congenital deformalities that could be present in a newborn. Your heart has two ventricles, the right ventricle and the left ventricle. The right one pumps the blood into the lungs to get the oxygen, and then this blood comes back to the heart, where a left ventricle pumps the same blood further into the rest of the body, and that way rest of the body can get that oxygen. So the left ventricle cannot squeeze this blood out of the heart and cannot that way supply rest of your body, because this stenosis is narrowing the valve and it doesn't allow left ventricle to properly supply rest of your body with blood. So what can left ventricle do? It can do what every other muscle would do in this kind of situation. It can grow. Concentric hypertrophy. That's what it's going to do. The walls of the left ventricle will become thicker and stronger, and that way they will be able to squeeze this blood and maintain this supply of the blood to the rest of the body. The heart walls have to be much more contracted to counter this pressure. They have to contract much stronger, and they're thicker. The end result of this is that heart needs more oxygen and it's getting less oxygen. The stenosis can progress. So if the heart is getting less oxygen, that explains the angina pectoris, the pain in your chest that might be radiating into your arm but doesn't have to, or might be radiating into your neck but doesn't have to. But why would anybody be fainting or feel like loss of breath? Well, we already explained that heart is trying to pump the blood with oxygen to the rest of your body. That includes the brain. So if there is a stenosis that prevents this, well, then it's pretty clear why somebody might faint, because the brain is not getting that oxygen it needs. But wait, still, why would anybody experience shortness of breath in this kind of situation? Well, if the left ventricle cannot pump the blood into the aorta and to the rest of the body, well, it's going to create pressure inside of the left ventricle when it contracts. What it can do further is create more pressure towards the lungs, because that's where this blood is coming from anyway. The pressure increased in the lungs results in shortness of breath. That's a lot of talking about the symptoms. But how do we really confirm if the patient has aortic stenosis? The first thing we can do is listen to the patient. But since we described all the symptoms, let's assume that's what the patient was telling us. The next thing we can do is inspection and palpation. We would be looking for pulses. The radial pulse of the radial artery, and the carotid pulse, the pulse of the carotid artery. These pulses would either be weak or completely missing. The next thing we can do is not listen to the patient, but listen to the patient's heart. We take the stethoscope and we place it on the second intercostal space on the border of the sternum, the right border of the sternum. That's where we can actually hear the stenosis the best. The pathological thing that we could hear is a heart murmur that appears after the first heart sound. Now, that doesn't tell you much, does it? So let's explain it. You put the stethoscope on the second intercostal space on the right border of the sternal bone, of the sternum. And there you expect to hear the pathological sound that this valve would be creating. Normally, you would expect to hear two sounds. That will be the first sound, that is at the beginning of the contraction of the heart, and then the second sound when all the blood left the heart and the valves close so they don't let the blood come back in. That's your second heart sound. So first heart sound, beginning of the contraction, and the second heart sound, closing of the aortic valve and the pulmonary valve. We would expect to hear the heart murmur in a patient with an aortic stenosis right after the first heart sound. Because remember, that's when heart is squeezing this blood out, and that's when stenosis is not allowing that blood to go out. So after the first heart sound, when the contraction starts, the heart starts squeezing the blood out, but the stenosis is making that harder for the heart. And that's where the sound comes from. All right, so you know the theory, you know where to put the stethoscope, you know when to hear it, you know what it should be, but how does it actually sound like? Well, here's your left ventricle, and it's trying to squeeze the blood out. Because it's having some hard time, you can hear the noises of that blood not really leaving the heart easily. And what you can hear is that's it. All right, so what else could we do to prove that this patient really has this aortic stenosis? Sure, the symptoms are okay. We heard something, we think it's the aortic stenosis, but can we actually see it? Well, yes we can. So what can we do? Well, we can do ECG and look for abnormalities in the ECG, but we want to see it. We want to see this stenosis. We're tired of assuming. We want to see this stenosis. So the next thing we can do is an X-ray. In this X-ray, we would expect to see the calcification in the valve. Well, in the echocardiography, we can finally see that this valve is thicker, it's moving much slower. And remember what we said earlier, that the heart would grow. We can see this concentric hypertrophy of the left ventricle. We can also perform the procedure called a cardiac catheterization. This is the procedure to measure the blood pressure inside of the heart, inside of the left ventricle and the aorta. The blood pressure difference can tell us actually a lot. We would normally expect a lower blood pressure in the aorta. This procedure is done by inserting a catheter, which is basically a hollow tube that is inserted in larger blood vessels, and then the instruments can be navigated all the way to the heart. And in the heart, we can perform these procedures. We can also perform additionally a procedure called the angiography to illustrate and see the heart blood vessels. So let's say we heard the patient, we heard the symptoms, we performed the examination and the diagnostics, and we finally have the diagnosis: aortic stenosis. What now? Therapy. But how? Normally there is a conservative way to treat it and a surgical way to treat it, right? Not really. Here, conservative treatments with medication don't offer long-term benefits. So sadly, there is no conservative way of treating the aortic stenosis. Surgically, we're looking at the aortic valve replacement, but this can be done in different ways, and there are different indications for the surgery. And it's a broad topic. We're going to discuss that in one of our next videos. If you need more help and information about symptoms, then go to symptomsky.com. There you can find experts and our software for symptoms. If you are studying or teaching medicine, then go to anatomsky.com. There you can find these animations and 3D models in software I made.